Okay, the steps that are typical for a typical robotic hair restoration procedure are starting out by the right patient selection. And what I mean by that is by taking a Norwood 3A, 4 on up to Norwood 5s. These are patients who are going to be predictably good patients for FUE procedures. That into consideration with the age of the patient and a strong family history on the father's side will predict a reliable amount of success preoperatively so that you don't render a patient with unaesthetically desired results. So first and foremost is patient selection. In order to digitally map the donor area, which is typically in the back, and that can go from anywhere from around the ear to the other ear and in the back. The system really requires that you have approximately hair lengths of 1 to 1.2 millimeters for the robot to detect this. Well, one of the questions that has come up is, do I need to shave my head? And the answer is not really. You can, however, people with long hair that have hair that is 2 or 3 or even 4 or 5 inches long can pull that hair up in the back and allow us to shave a small strip and accept a smaller case, and with the affording you the ability of being able to hide that and not have to walk around with your head shaved. On the other hand, there are patients who are rather indifferent about shaving their head, both the back or the front and the back or the entire head itself. And those patients are typically patients with a more progressive hair loss. They need more grafts. They want to have a single session or limit the number of sessions in the robot to 2, and they have a lot of grafts to be transplanted. Those are cases that we want to make sure that we're shaving the majority of the hair in the back for the donor, for the robot to recognize the transplantable hairs.